Your blood pressure monitor says you're fine, but what if it's wrong? Home BP monitors are great tools, but even the best device can give false readings if you're not using it the right way. And the truth is, most people make at least one critical mistake without even realizing it. A wrong reading could mean taking meds you don't need, or worse, ignoring a real problem. In this video, we'll uncover the most common mistakes people make when checking blood pressure at home and how to fix them fast. These aren't just minor slip-ups. They could completely throw off your numbers and mislead your doctor. Let's start with mistake number 1, using the wrong cuff size. Think all BP cuffs fit everyone? Think again. The wrong cuff size can throw off your reading by 10, 20, even 30 points. Most people don't realize that using the wrong size cuff is one of the most common and most dangerous mistakes when measuring blood pressure at home. And unfortunately, many monitors come with a one-size-fits-all cuff that actually fits very few. A cuff that's too small will squeeze your arm too tightly, giving you a falsely high reading. A cuff that's too large may not apply enough pressure, giving you a falsely low reading. Either way, the result is the same: inaccurate readings and potentially the wrong treatment. How to know if your cuff is the right size? Your blood pressure cuff should wrap snugly around your bare upper arm, with the bladder, in other words, the inflatable part, centered over your artery and covering about 80% of your arm circumference. Here's a quick guide based on arm circumference. Small cuff, 22 to 26 centimeters. Standard adult cuff, 27 to 34 centimeters. Large cuff, 35 to 44 centimeters. Extra large cuff, 45 to 52 centimeters. Use a measuring tape to measure around your upper arm at the midpoint between your shoulder and elbow. If your cuff doesn't match your measurement, you need a different size. Tip: never assume the cuff that came in the box is the right size for you. Signs you're using the wrong cuff size. The cuff feels extremely tight or painfully loose. Your readings vary wildly from day to day without lifestyle changes. Your doctor's office readings are consistently different than your home readings. You need to stretch or force the cuff to make it fit. If any of these sound familiar, you're probably using the wrong cuff. What to do? Measure your arm circumference and compare it to the cuff's range printed on the inside of the band. Buy a replacement cuff if needed. Most BP monitors allow you to switch out cuffs for different sizes. Avoid wrist or finger monitors, as these are more sensitive to cuff placement and arm position, often leading to inaccurate results. Also, make sure you're applying the cuff directly on bare skin, not over clothing. Even a thin shirt can mess up the reading. What your doctor would tell you. Doctors and hypertension specialists will tell you this: if your readings don't make sense, start by checking your cuff size. It's one of the first things they'll look at when your numbers aren't adding up. So before you blame stress, salt, or medication, look at the cuff. You might be fighting an invisible enemy that's been on your arm the whole time. Next up, mistake number 2, poor posture or arm position. Slouching just a little? Resting your arm too low? That simple mistake could make your blood pressure reading jump by 10 points or more. Proper posture is not just about comfort, it's critical for accurate readings. If you're sitting the wrong way or your arm isn't supported correctly, your blood pressure monitor could be giving you numbers that are totally misleading. Why posture and arm position matter. When you measure blood pressure, you're trying to get a true sense of the pressure inside your arteries. But gravity plays a role. If your arm is hanging too low or your back isn't supported, it changes how your heart pumps and how blood flows, leading to distorted readings. A small mistake in posture can mean the difference between a normal reading and one that looks like a crisis. Correct sitting position for accurate BP readings. Here's the doctor-approved position. Sit upright in a chair with your back straight and supported. No slouching or leaning forward. Keep both feet flat on the ground, not crossed or dangling. Rest your arm on a table or flat surface so the cuff is level with your heart. Relax your hand, palm up, and don't tense your arm or shoulder. Your arm should be supported, not held up by your muscles. If it's too low, your BP reading may appear higher. If it's too high, it may seem lower than it really is. Common mistakes people make. Measuring BP while sitting on a soft couch or bed, letting the arm dangle by the side or resting it on the lap, crossing the legs, leaning forward or backward, holding the monitor with one hand while trying to check the other. All of these can throw off your numbers by 5 to 15 points, and you won't even know it. Real example. Let's say your true blood pressure is 125 over 80 millimeters of mercury. But if you're leaning forward, legs crossed, and your arm is too low, your reading might say 140 over 90, sending you into panic mode or prompting your doctor to increase your meds unnecessarily. On the flip side, if your arm is too high, the reading could be falsely low, making you think everything is fine when it's not. How to fix it? Choose a straight-back chair and place a firm pillow or folded towel under your arm if the table is too low. Don't cross your legs and avoid sitting on soft, sinking furniture. Set a routine spot for BP checks. Same chair, same position, every time. If you're unsure, ask someone to help you get set up, or take a photo and compare it to correct posture diagrams from trusted medical sources. What doctors say? Posture and positioning are among the top reasons patients get inconsistent readings at home. That's why clinics are so specific about how you sit during a check. They want accurate data, and so should you. So before adjusting your meds based on home readings, make sure you're sitting the right way. It's a small fix with a big impact. Next up, mistake number 3, measuring at the wrong time of day. Did you know your blood pressure can change dramatically throughout the day, even if you've done nothing wrong? One of the most overlooked reasons for inaccurate home readings is poor timing. Blood pressure naturally fluctuates, so if you're checking it at the wrong times or without consistency, you're not getting the full picture. Why timing is critical. Your blood pressure follows a daily pattern called the circadian rhythm. It usually rises in the morning, peaks in mid-afternoon, falls in the evening, drops lowest during sleep. This means a reading taken at 7 a.m. might be completely different from one at 7 p.m., even if nothing else changed. If you're only checking your BP at random times, your numbers may appear artificially high or low, leading to confusion, unnecessary medication changes, or even missed warning signs. When should you measure? According to the American Heart Association and hypertension specialists, if you're just starting to monitor, take 2 readings daily for 5 to 7 days, once in the morning, before eating or taking medications. Once in the evening, at least 30 minutes after dinner, not right before bed. This helps you and your doctor establish a true baseline. If you're monitoring long-term, check your BP at the same times of day a few times per week, unless your doctor tells you to do it more often. Consistency is everything. It's less about how often and more about when and how regularly you measure. When you should not measure, avoid checking your BP right after waking up suddenly or after a nap, immediately after exercise, after caffeine, smoking, or alcohol, when stressed, rushed, or in pain, right after eating a heavy meal. These situations can cause temporary spikes or drops that don't reflect your actual blood pressure status. What happens if you ignore this? Let's say you measure your BP every day at different times. Monday morning, 138/85. Tuesday evening, 120 over 78. Wednesday afternoon after coffee, 145/90. These readings seem inconsistent, but in reality, they reflect your body's natural fluctuations combined with poor timing. Without a pattern or standard time, your doctor may not be able to interpret your readings accurately, and neither can you. What doctors recommend? Here's what a doctor would want to know. Are your readings taken at the same time daily? Did you follow the resting period before measuring? Were you under stress, or had you just eaten, exercised, or consumed caffeine? Bringing your doctor a log of BP readings taken consistently at appropriate times is far more helpful than random numbers scattered across the day. How to fix it? Pick 2 consistent times each day and stick with them. Set a reminder on your phone if needed. Write down what you were doing before the reading. This can help identify patterns. If you feel a little off, dizzy, tired, or anxious, and want to check your BP, it's okay. But don't use that one reading as your average. Always compare it with your usual timed readings. Next up, mistake number 4, talking, moving, or being anxious during the reading. You sit down, strap on the cuff, and casually chat with your spouse or check your phone. Seems harmless, right? But that simple movement or small talk could spike your reading by 10 to 15 points. If you want an accurate blood pressure reading, you need to sit silently and still. Even a little conversation or a twitch can give you a reading that looks way worse than it actually is. Blood pressure is extremely sensitive to movement, emotions, and muscle tension. When you talk or move, even slightly, your heart rate can rise, your blood vessels may constrict, and the monitor picks up on all of it. Even mental stress, like worrying about the result, can cause a short-term spike. This is called the white coat effect when it happens at the doctor's office. But at home, it's often a result of multitasking, distraction, or anxiety. Common mistakes that raise your numbers. Talking during the reading, even softly. Looking at your phone or reading. Crossing your legs or tapping your foot. Tensing your arm, shoulder, or jaw. Being emotionally upset, rushed, or worried. All of these small actions can increase your systolic top number by 5 to 15 millimeters of mercury, sometimes even more. What doctors recommend for a clean reading? To get a reading your doctor can trust, follow these steps. Sit quietly for 5 minutes before measuring, no talking, no distractions. Rest your feet flat and arms supported at heart level. Take 2 to 3 readings a minute apart and average them. Breathe slowly and naturally, don't hold your breath. Avoid looking at the monitor while it inflates. It can raise anxiety. If you're stressed or anxious, wait a few minutes before measuring again. Let your body return to a calm baseline. Pro tip, don't chase perfect. Many people take their BP multiple times back to back, trying to get a number they like. This only increases tension and can lead to inconsistent results. Instead, take 2 to 3 measurements, average them, and use that as your result. If one is wildly different, discard it. What you can do. Designate a quiet space in your home for BP checks. Turn off the TV and put your phone away. Close your eyes and take deep breaths before pressing start. Let your family know not to interrupt you during the reading. You only need 2 to 3 minutes for a proper reading. Make them count. Why this matters so much? Inaccurate readings caused by talking, moving, or stress could result in being misdiagnosed with hypertension, getting prescribed stronger medication than you need, feeling discouraged by false high numbers. Doctors rely on your home readings to make big decisions. Help them help you by giving them numbers they can trust. Next up, mistake number 5, not following the 5-minute rest rule. You just walked in the door, climbed the stairs, or had a quick snack, and now you're checking your blood pressure? That number you're seeing? It's likely not your true resting BP. One of the biggest mistakes people make is skipping the 5-minute rest period before taking a reading. And this single error can inflate your numbers dramatically, even if everything else is perfect. Why the 5-minute rest matters. Your blood pressure isn't a fixed number. It responds to your activity, stress, temperature, and even emotions. If you take a reading too soon after walking, talking, eating, or rushing around, your numbers will reflect temporary spikes, not your baseline. That's why both home monitoring guidelines and professional medical protocols emphasize the need to sit quietly for 5 full minutes before pressing start. Think of it like this. Would you weigh yourself right after eating a big meal? Probably not. The same logic applies here. What happens if you skip it? If you take your reading without resting, your systolic BP, top number, can jump by 10 to 20 millimeters of mercury. Your diastolic BP, bottom number, may also rise by 5 to 10 millimeters of mercury. Your heart rate may be elevated, giving the impression of stress or illness. This can lead to a false diagnosis of hypertension, unnecessary medication increases, anxiety over numbers that don't reflect your true condition, when to rest and when to wait longer. You should rest for at least 5 minutes in a quiet, comfortable place. But certain situations may require even longer rest, such as after climbing stairs or physical activity, after emotional stress, an argument, rushing, etc., after eating or drinking caffeine. If you're feeling nervous or shaky, in these cases, wait 10 to 15 minutes to let your body stabilize. How to build the rest rule into your routine. Choose a consistent time of day when you're least rushed. Set a timer for 5 minutes and use that time to breathe slowly or sit in silence. Avoid multitasking. Don't read, scroll, or talk during this period. Sit with feet flat on the ground, arm resting at heart level. Pro tip, Treat BP checks like meditation, quiet, calm, and focused. It's not just about the number, it's about the conditions under which you get that number. What doctors say. Doctors often ask patients, did you rest before taking your home readings? If the answer is no, many will ignore the result or ask for retesting. That's how critical this step is. They know that skipping rest is one of the biggest culprits behind false readings and why many patients are told they have high blood pressure when they actually don't. Waiting 5 minutes might feel like a small thing, but it can be the difference between accurate data and dangerous guesswork. So don't rush it. Respect the rest. Your heart and your health depend on it. Next up, bonus mistakes. Things like caffeine, cold rooms, full bladders, and even tight clothes can silently mess with your numbers. Bonus mistakes, small things that can mess up your blood pressure reading. You followed all the major steps, but your blood pressure still seems off. What if the culprit is something small, like your morning coffee, a cold room, or even a full bladder? These minor details often fly under the radar, yet they can secretly raise your numbers and make it seem like your blood pressure is worse than it really is. Let's go over some bonus mistakes that could be skewing your readings without you even realizing it. 1. Caffeine. Within 30 minutes. That morning cup of coffee or energy drink can temporarily raise your blood pressure, especially if you're caffeine sensitive. Studies show that caffeine can increase systolic readings by 5 to 10 millimeters of mercury for several hours. What to do? Avoid caffeine at least 30 to 60 minutes before measuring your blood pressure. 2. Full bladder. A full bladder can raise your systolic pressure by as much as 10 to 15 millimeters of mercury. Your body responds by activating stress hormones, even if you don't feel discomfort. What to do? Always use the bathroom before checking your BP. It's a simple fix that can make your reading more accurate. 3. Cold room or cold body. Cold temperatures cause your blood vessels to constrict, increasing blood pressure. If you're in a chilly room, barefoot on a cold floor, or underdressed, your numbers may spike. What to do? Ensure the room is warm and comfortable and wear appropriate clothing, but not so bulky that it affects cuff placement. 4. Measuring over clothing. Even a thin shirt sleeve under the cuff can interfere with the reading. This creates extra pressure between the cuff and your artery, often leading to false high readings. What to do? Always place the cuff directly on bare skin, no shirts, sweaters, or jackets underneath. 5. Measuring before medications take effect. If you take blood pressure medication in the morning, your BP may be higher before the meds kick in. This isn't necessarily a bad thing, but it's important to be consistent. What to do? Ask your doctor whether you should measure before or after taking your medication and stick with that timing for all readings. 6. Stress, anxiety, or rushing. Running late? Arguing with someone? Checking your BP right after a stressful moment can elevate your numbers sharply. Even the anticipation of a high reading can create anxiety, raising your BP further. What to do? Create a quiet, calm space. Take 3 to 5 deep breaths before pressing start and try not to think about the number while it's measuring. Why these details matter. These minor mistakes may seem harmless, but combined, they can raise your systolic pressure by 20 points or more. That's enough to turn a normal reading into a hypertensive one. And the worst part? Most people don't even know they're doing anything wrong. By avoiding these bonus mistakes, you're giving yourself the best chance at getting reliable, consistent readings, and helping your doctor make smart, data-driven decisions for your treatment. Next up, let's bring it all together in the final conclusion. Your blood pressure monitor is only as accurate as the habits behind it. Now you know the truth. One wrong move can lead to a completely wrong reading. And that wrong reading could mean unnecessary medication, missed warning signs, or a false sense of security. But the good news, every one of these mistakes is fixable. Let's quickly recap the major points. Use the right cuff size for your arm. Sit with proper posture, feet flat, back supported, and arm at heart level. Check your BP at the same time every day, not randomly. Stay silent and still during the reading. No talking or texting. Always follow the 5-minute rest rule. And don't forget those bonus tips. Avoid caffeine, use the bathroom first, measure on bare skin, and relax. These simple changes can make a massive difference in the accuracy of your numbers. And accurate numbers? That's what helps your doctor give you the right treatment at the right time without overreacting or missing anything. So here's your next step. Before your next reading, take 2 extra minutes to prepare properly. Treat it like a health ritual, because that number you get, it matters. If this video helped you, give it a thumbs up and share it with someone who checks their BP at home. And let us know in the comments, which mistake were you making and what will you fix starting today? Don't forget to subscribe for more doctor-approved tips to take control of your health, one smart question and one accurate reading at a time.